The best thing that a surgeon can do is really saying, hey, this surgery will not help you, and therefore we shouldn't do it. This whole myth about you have to decide right now is completely bogus. I had this patient who was unrealistic expectations, relatively impatient. He wanted a quick fix, and it was me. And it taught me such a valuable lesson on to be more patient, to be more understanding, not try to seek that quick fix. Most of the surgery is considered an elective, meaning they elect to get it after we've gone through a trial of conservative treatments. It's literally fear of the unknown. God grant me the serenity to accept the things I cannot change, the courage to change the things that I can, and the wisdom to know the difference.
Welcome to ShoulderWise, the podcast where clarity, strength, and care come together for every shoulder journey. Today, we're going right at one of the biggest questions patients ask, especially ask Dr. Szerlip on a regular basis: do I really need surgery? So today, he's here and he's had these conversations every day. And today, he'll share not only the medical side of it, but the human stories that make these decisions so personal. So, Dr. Szerlip, thanks for being here. I know a lot of people are listening, eager to hear about your experience and how you handle this question and deal with people's nerves essentially around this. So I'm excited to chat today.
Yeah, thanks, Layla. I'm excited too. And I really think that this is one of the most important topics. It's one of the hardest ones to deal with, from an emotional standpoint, from an intellectual standpoint, and how we tie it all together to help each other make decisions in life is, it's cool and it's a secret that we all have to crack. The question is, do I really need surgery? And it's the most common one. I had it today, actually, a super nice patient, and we had a great 20-minute conversation. And we still then decided to start and say, hey, we're going to meet again. We're going to talk some more. So I think that this whole myth about, you have to decide right now is completely, bogus. I'd say 95% of the time you have the time to process this information, to wait, to learn more, and to ask more thoughtful questions, because our brains are usually trying to intake all this information, and then we can't process the decision quick enough. So I think it's totally fine to get more info and to wait as well. I think it makes patients feel more comfortable. But do I really need surgery? To answer your question directly, is I think that this is an opportunity to help somebody. I think that when somebody says, do I need something? And they come to you in your office, it's saying, I need help from somebody I consider an authority on the issue, and somebody that I can trust to give me advice based on my best interest, what's best for me. And we need to investigate what that is. We need to talk and learn and know, to kind of tailor that treatment plan towards each patient. So we all got into medicine, I think, to some degree to help others, right? And then empowering them to make their medical decisions with the critical information that we have, not only based on the research and the studies that are out there, but also years of experience or training. It's a huge reward for the patient, for the doctor, for everybody involved. So I think that some of these other questions we're going to talk about will help dig into how we actually process the information and how we do that.
Absolutely. And I'm sure from your end, it's a lot to process and also not maybe, the easiest thing to convey to someone, because it can be, a scary thing. I think at surgery, I get a little nervous. So when a patient is sitting across from you and they nervously ask you, do I really need surgery? What runs through your mind right away?
So we have to gather the information, and it's by criteria. So does the patient need a surgery? It's really, are they gaining value from it? Needing something, it could be, hey, you may have cancer. That's a more extreme on one side of the spectrum, where if you don't get a surgery, it could be life-threatening, right? And so that is more of a more clear-cut, more black and white answer. Do I need surgery? Will it benefit me? And then so when we do musculoskeletal treatments or injuries, a lot of times it's saying, hey, I'm having increased pain, or I have problems with a performance, or I know it's going to get worse or I may do more damage. So if we consider a surgery on those factors, pain is a little bit subjective, right? And, function, it depends on the patient's age. So I just had a patient in their 30s. They're a professional wakeboarder here in Austin, Texas. So they're professional athletes in essence. And then I have other people who are, in their 50s and 60s and say, hey, I work at a desk and I really enjoy, putt golf and other types of more low demand leisure activities. So I think that you have to take each patient's age, their functional levels, their symptomatic treatments, and the actual diagnoses. So I think that those are all factors that go into that decision-making process. So needing a surgery, it's pretty rare, honestly. Most of the surgery is considered an elective. So when I say elective, meaning they elect to get it after we have gone through a trial of conservative treatments that don't entail surgery, and they're still having significant symptoms, limitations in their function, or it's not getting any better with those other treatments.
Absolutely. And when patients are thinking about needing a surgery or potentially having to have one, what do you think the most common fears that they have are when they hear the word surgery?
Yeah, fears for sure, and I'm one of them. So I will talk about more about personal experience, but it's good to put yourself in that patient's shoes. But common fears, and we have that every day. And I think that one of the major keys to well-being is the perception of control. Not that we know that we have control, because a lot of life is out of our control, but the perception that we have control. And a more popular term in the mental health field right now is a sense of agency. And some people are like, what is that? It's essentially a belief that your choices and action matter in shaping your life. So the multiple studies and scientific data out there consistently showed better mental health in resilience and life satisfaction of participants who felt they were able to influence their circumstances, relationships, or responses to how they did something. And surgery is absolutely no different. So if we're saying, hey, what are people scared of when they think of surgery? And why are you talking about agency? A strong argument can be made that the fear of having a complete lack of control in surgery is one of those things. It's literally fear of the unknown. In most cases, you're going to sleep. You're completely unconscious and somebody's doing something you're probably not familiar with. You probably don't understand that well. And you're trying to get more information, but that's almost the definition of being out of control. So I think that that's what the stem from fear is. As soon as we understand that, we can then take the fear and the emotion out of the equation, right? Because then we have to process this information to make the best decision for ourselves, right? And then ask questions that will help us in our recovery or optimize our goals or our outcomes. So I think that, oftentimes there are specific concerns about recovery time. I think that's probably the most common. Like, hey, when can I do X, Y, or Z? When can I type at a desk again to maybe do my job? When can I pick up my kid again? When can I drive a car? When can I go skiing this winter? In October, which we're in right now, I have people already planning ski trips, weddings. So that's really helpful to help them understand their timeline, potential pain that might be from the procedure, and how can they expect that and how they can control it. There could be financial cost barriers. I think now more than ever, insurance is varied and different, and some people think it's even crazy. But I help them understanding what costs they're going to have, or if they have to take time off work, I think that's a big deal. Or if they're having to care for somebody else, like a child or a parent, they need to know that too. So helping fill in all these blanks and the fear of the unknown and some of those other factors we mentioned are part of our jobs to fill in those blanks when we help patients or counsel them out of surgery.
Absolutely. Those are all, very valid, I think, concerns from someone who is going to have surgery, especially when they have to take care of other people as well. And they have important hobbies that they love and work and finances and all of those things. So I know from their end, there's probably a lot of decisions and again, a little bit of fear, but decisions and different thought process and things to figure out. But when it comes to you and your decision making, in terms of whether or not someone would be a candidate for surgery. Can you walk us through your decision making a little when you evaluate a shoulder injury? what key factors really determine whether you recommend a surgery or not?
Yeah. And I think that's the key, right? So we've talked about some of the fear and some do I need one or not? Does it provide value? And it's the different criteria for, considering an urgent or emergent surgery versus an elective one when we elect to get to improve the quality of our lives. But it really does come down to some of the criteria and will hopefully make it easier for patients to digest and then make the decision for themselves. But first of all, you kind of need to know that you're kind of at the right place with the right person with the right training and experience. But really it's understanding and confirming the diagnosis, right? Do I have x-rays or is this diagnosis made on clinical exam and a patient history? Is the diagnosis made on an imaging like an x-ray or an MRI? It's usually a combination of all those things, but do we have an accurate, almost firm or guaranteed understanding that we know that this is the problem, right? And so not all the time we're coming in and trying to we're doing some detective work, as we had talked about in previous podcasts, to find out what that is. And then once we do have a firm lock on that diagnosis, or it could be multiple ones, do we have data that actually makes us confident that if that diagnosis is the problem, that this potential surgery will provide the best solution, right? So if we have this problem, will this, surgery provide us pain relief? Will it provide us preventing future damage? Will it improve our function or allow us to do X, Y, or Z better at our job or the hobby that we enjoy? So I think that those criteria are critical. And then there are several other things. So if somebody has a diagnosis, and this is more subjective on this third category, but do we have significant symptoms that bother us, like on an everyday basis or a consistent basis, however people would define that? Some people say it doesn't bother me at all when I'm not doing anything. And you're like, hey, there's no problem. But every time I try to exercise, every time I go to my job, which requires that I have to lift something over my head, then I'm in pain, or I can't sleep at night because it wakes me up and I can't get more than 3 hours of sleep. If people have experienced that or they have small kids, getting 3 hours of sleep each night can have a huge impact on the rest of your life. So some people, like, how much do the symptoms bother you? And I think that people can kind of rate that on their own severity scale. So there's other things too. So if we go off those three things, so do we have a diagnosis? Do we have evidence that shows that that surgery would, improve that diagnosis or help relieve or solve the problem? How bad are the symptoms, right? And really, have we tried other non-operative treatments? Have we tried giving it time? Have we tried medications? Have we tried physical therapy, which is, we talked about the last other podcast, is critical to most people's treatments in the musculoskeletal field. So you can say, hey, have we tried these non-operative modalities? And is it getting any better? And if they say, I've tried all those things and no, it's not getting better. It does bother me consistently every day. And it's also, affecting my quality of life in terms of I can't do the things that I need to do for my activities of daily living or I enjoy with my hobbies. There are even more factors to help dissect this out. And it's not to overwhelm the patient. It's really just they can plug this into their own algorithm or scoring system and then help them make their decision. So take the subjectivity out of it and make it more objective. But do these patients have realistic expectations on what they need to do or want to do? I think it was my mistake. I had an older patient who he could barely lift his arm up, and we did a shoulder replacement, but he was somewhat frustrated that he couldn't throw a football over 20 yards. He could throw it up to 20 yards, but he couldn't throw it over. So he was a little bit disappointed on his outcome. So I think that it's important that we talk about what we can expect from the surgery and what we cannot to get. And there is a bell curve on that. I think the other things are medical optimization. So when we talk about, like, is the patient a smoker? Are they having a problem with drugs? Or do they have diabetes or a certain problem with obesity that maybe this surgery is this diagnosis, the surgery could potentially benefit, but we need to have the patient make sure that their sugars are under control, or that maybe a weight loss program before that would be helpful. And knowing that we can decrease that patient's risk for a complication after we medically optimize those issues.
Definitely sounds like there's so much that goes into the decision-making process, way more than I would have even ever assumed or considered. But it makes a lot of sense in terms of their everyday life too, of how much is this injury, this pain really preventing or stopping from your everyday life. And then also being able to look at the potential outcome and kind of gauge what their life would be like post surgery. But I know that you've said this before about not being a scalpel first surgeon, and you definitely take a lot of into consideration in these decisions. So, like for example, physical therapy and thinking of other things as well before just jumping to surgery. So, being that you consider yourself not to be a scalpel first surgeon, where did that philosophy come from? And was it a mentor or was it something you came up with yourself, one of your own values?
Um, yeah, I definitely would credit my mentors and a lot of the people that I work with. I worked with, my uncle and he used to be a plumber and help other people get water in rural areas. He, like there's other people who worked in construction and like we talked about earlier. And if you, you know, if a person or organization prioritizes honesty and integrity, they will succeed. They will get people's, trust and respect. And I think that if we just give the impression that we're trying to push them into a surgery or recommend something, I think that people are very good at quickly realizing that. And one of my favorite authors and somebody who I'm to have dinner with someday, but Malcolm Gladwell kind of talks about in his book, Blink, that we all have this ability to kind of gauge people and say, hey, are they looking out for my best interest? Do they understand my values and what I want? And then will they help me get there? So I think so the best thing that a surgeon can do is really saying, hey, I'm going to talk you out of a surgery. I think I've seen some of the best people in the country operate. And they used to come from all over the country, all over the world, so they could get their surgery from that person. And they get the best results because saying, hey, this surgery will not help you. It won't accomplish the goals that you want it to. And therefore, we shouldn't do it. And that seems surprising. But if you have the right patient selection of telling the patient whether they're a good candidate or not, that's the best thing, because if you don't have a plan, or if you have the wrong plan before you get in the operating room, you'll fail before you even start. I think an even easier way to say it, and one of my mentors, is huge Kenny Rogers fan. So if you listeners out there are familiar with the song, let's see, from The Gambler, you have to know when to hold them, know when to fold them, know when to walk away, and know when to run. And I think we as doctors and we as patients need to understand that as well.
Absolutely. And it's interesting because we were just even talking about patients and their fears of surgery and a lot of people not wanting surgery, but I didn't even think about it. There's probably patients who are like, yeah, I do want a surgery and it will fix everything and let's do it. And like you're saying, it's not always the best approach. So, can you share an example of someone like that? Maybe a patient who came in and was convinced that surgery was inevitable and maybe the best thing for them, but you guided them through a non-surgical path that worked, maybe even better than the surgery.
Yes, I had this patient who was unrealistic expectations, relatively impatient. He wanted a quick fix and didn't have time, felt very inconvenienced by having an injury or dealing with your recovery times. And it was me, right? And that was the best thing to do. It was the best thing that ever happened to me because so when you finish residency, and you're kind of in your 30s, right? And I'm very fortunate, very, lucky and healthy. But then so it was hard to identify with patients. But then I did have an injury. I was still a competitive athlete and I tore a ligament in my foot. And I had a hard time. I was walking around in a boot for 6 weeks and I had a hard time running. And it really kind of got to me when I couldn't, run along with my kids. My kids were even younger then. We were trying to teach them how to ride a bike and, running or getting any kind of activity was really difficult. So I was convinced that I needed a surgery. I wanted to be done. I wanted to move on. And so the best way that some of my mentors and some other doctors, some other colleagues that I talked to throughout the country, they're like, hey, this isn't the best surgery for you. You need to treat it without surgery. You need to treat it with therapy. And I said, hey, I've tried therapy for a whole 2 weeks. And, they were laughing because I was like, hey, this isn't working. essentially we as Americans, I think we're conditioned, and I like to make fun of myself because it can happen to every one of us that I'm frustrated when I don't get my Amazon package in 2 days, right? And so we do have this like, quick fix, get it done. I don't have time for this. But I actually worked with a therapist who had dealt with the same problem. And so we were doing the therapy in a wrong way, and I saw a different therapist, and so trying to tweak different things. And a lot of coaches and success stories in business or athletics, they'll say, hey, if you can change 3 variables that will change things even 5%, well, that's 15% different. And so the same therapist had actually dealt with the problem because one of my legs is actually rotated considerably more than my other. And so they kind of had to reteach me how to run and even do certain sports or activities in order to take pressure off that area where the bone was stressed and the ligament was torn. And so it took me probably 4 to 6 months to learn how to run and rework my gait, but it made all the difference in the world. And it taught me such a valuable lesson on to be more patient, to be more understanding, not try to seek that quick fix. And I'm eternally grateful for the doctors who kind of stuck by my side and said, hey, surgery is not the right answer.
Absolutely. Yeah. And it's great that you had that particular surgeon and providers to give you that insight and not just say, hey, let's go through with the surgery. But as a surgeon now, and on the flip side of this, can you tell us about a time that you had to tell someone, yes, surgery is the best option, and even when the patient may have been hesitant? So, how did you build trust in that moment?
Yeah, I think that that's a great question that I still my answer still evolves every year that I treat patients, and I think in some ways that we have to counsel the patients the same way, right? And if we as scientists, as engineers, it's different than salesmen. Engineers seek the truth. They will give it to you black and white. And sometimes, your accountant will just tell you how it is and not really care about how you feel about it. It's just, it is what it is. Right. And I think that somebody who's trying to sell you on something will change their approach or try to take a different pathway to get you to appeal to something. So if we believe that surgery is the right answer, we'll give that recommendation, and you present it in a way that it's an evidence-based answer. So, hey, this is the diagnosis. This is what the evidence shows that you would improve. But it really does come down to a quality of life. And so if those patients make the decision saying, hey, it does bother me consistently, or hey, it would improve my functional outcome, or I tell them sometimes that this is a problem that would do more damage in the future. And then we'd say, hey, you don't have to make any decisions. Just take the time, process, ask more questions. And some of them even want to get a second opinion. And I think that's totally reasonable, making a big decision. So I think that allowing them to make decisions at their own pace, at their own time with the information is key. But I think one of the things that I've learned in the past couple of years are, I tell them, how would you treat your spouse or how would you treat your kid? And I say that because oftentimes we tend to punish ourselves or neglect ourselves when deep down it's that fear or lack of emotional regulation that this thing is holding us back. But we know, like I know my kid should get an injection when they need it, or I know my family member should get a certain treatment, and I wouldn't withhold that. But sometimes we tend to procrastinate when it comes to our own healthcare.
Yeah, absolutely. No, for sure. But even in those situations where, you know, where you think to yourself, surgery is the smartest step, right? What's a common sign or a common situation that really does point that out to you?
Yeah, I think that, the previous question, we went over a couple criteria, and I
Mhm.
think those are all really helpful, but oh my gosh, it's overwhelming. So I tell people, and my wife, we came up with this solution. She only gives me 3 things to remember when I walk out the door, because if it's more, I'll probably forget. And I will admit that, and she's usually right almost all the time, but I don't tell her all the time. But I even forgot to pick up our kids. I got the groceries, but I forgot the kids at school. So long story short, the kids got picked up. But I think to get back to your question, I tell them, so the rule of three basic things, and we can elaborate on that. But does it bother me on a consistent basis or every day, right? And does it stop me from doing the things that I need to do, or through my everyday life or my job, or that I enjoy doing? And three, have I tried other things that non-operative treatments, and are those working for me? I think if you kind of boil it down to those three things, I think you could address 80% of the questions and problems. We also talked about, am I a good surgical candidate for, other medical optimization? But those three things, and I would say sometimes I'd ask the surgeon, is this going to do more damage, or can we watch this over time? So if we can keep it simple, I think that's going to help all of us in the long run, not just the people who don't know about medicine. And
Absolutely.
maybe I'll pick up my kids more often. That only happened one time, by the way. So
I mean, I don't have kids, but I couldn't see that happening to me too. So
it's
I
humbling.
get
Yeah.
it. I get it. The other day I walked my dogs and I came in the house and I was like, why is it so quiet? And I
Yes. Why is
realized
it
I
so
left
quiet?
one
Okay.
outside of the
So
door.
Yeah. Yeah.
So I
Quiet can be
get it.
dangerous. Yeah.
Absolutely. But talking about um indicators of needing a surgery or the decision making that goes into whether or not it really is the best idea, are there any myths about shoulder surgery that come to mind that you wish you could erase? I'm sure you hear all kinds of different things. And I'm sure when you make these decisions, patients probably come to you with some of these myths that they've heard. So, what's a myth that you really wish you could just erase? For example, kind of what you said earlier, surgery is this long, year-long recovery process. It's miserable. So, are any of these myths that you hear even true?
Yeah. That's, we talked about myths in the last top being that, hey, that physical therapy can address a lot of things, and that we don't always need surgery. We don't always need the quick fix like I told myself I did. I think that what I would say, hey, the myth for surgery, or what we could erase, or kind of not erase, but undo or process, is it's not a year factor. And to start, I think that my 2-word answer to you is negativity bias. And it's something that it's not that just negative people have. It's not something that, pessimistic people have and optimistic people don't. Negativity bias is what our brains were evolutionarily adapted to do. For example, if somebody scowls at us versus smiles at us, we're going to remember that scowl. It could mean danger. When we were in the hunter-gatherer phase, if somebody got eaten by a saber-toothed tiger, or you saw somebody get sick after they eat a mushroom, you would never go around tigers. You would never eat a mushroom. And, if you believe in all that, or not, but I bet people, if they watch the movie Jaws, that they may not get in the ocean the next day, right? And so that is an evolutionary adaptaceous, thing. But now in modern day society, if 20 people give us a compliment, but one person on social media tells us that our idea is stupid or we look funny, how many people are going to think about that all day, or they're going to ruminate about that, or if somebody at work tells you your project's a bad idea? We have to be able to understand why our brains think that and then process it. So the myth is that if we see somebody or hear a problem that one patient had problems for a year after their surgery, then we're conditioned to think that that's going to be our case, right? And it's perfectly natural. So I think that it's not, the negativity bias is not to erase or eliminate the problems. It's to understand that that's probably the exception to the rule, that on a bell curve, that is, probably going to be the 1 or 2%. And it's the reason why we all think that, though. Another factor is patients can see improvements in their condition for up to 1 year. And so it doesn't mean you're going to be out for a year, but I'll give you an example. So if people watch ESPN or sports or football or baseball, the playoffs are on right now. So the fall is everyone's favorite time to watch ESPN, right? And so if you have an ACL injury or a rotator cuff tear, you don't have to be a doctor, but most people understand those concepts. And that athlete is usually out or until the next season. And that can be a year. So these people who are paid millions of dollars to play sports, they're 20 years old. They're at the peak of their, physical acumen. Even they take 1 year to get back to their level of play. So it is, we're going to get back sooner, and patients do really well. But I think that we can expect to see improvements from a condition for 6 months to 1 year. It doesn't mean that they're out, if that makes sense.
And it doesn't sound like they'll be in misery for a year either, particularly. I know that that's something, like we said, is a big myth. They think that that whole year afterwards, they'll be in pain and agony and have to go through it for the entirety of a year. It's good to
Yeah,
know
yeah. I
that that's
think,
not the case.
and I didn't touch on that point too. Even so, I started residency. Let's see, I started in 2004. Man, 21 years ago. And so, in general, the process, the procedures, everything had changed. The technology's changed. I mean, at that time, cell phones, computers, TV screens, cars, every technology has changed. So we used to have to cut the shoulder open to do some of these procedures. Now it's done through a small camera, almost the size of a needle. And the hardware has changed, the technology's changed. The surgeries are becoming less invasive. The fixation or the anchors or anything else, the implants are stronger, lighter, better, longer lasting. So I think that over time, those things are evolved. So patients are getting back to work, within a week. Um, I have contact athletes who are full go without restrictions at 3 months. But I also warn people that, like there is a bell curve and everybody fits on that bell curve. It truly is hard to understand how some patients perceive pain and they're like, it doesn't bother me at all. And then
Wow.
so it is one of those factors. I think it's part in the chemicals that are processed through our brain, substance P and a couple other factors, dopamine, norepinephrine, but how we each process pain is truly amazing. And I think that hopefully we understand that better as scientists in the future.
Absolutely. Yeah. And everyone is different. Like, for example, people's pain tolerance, people's comfortability around surgery, around even hospitals for that matter. So I'm sure that there's so much that also goes into it, even from the patient's decision as well, whether they want it or not. And you have probably worked with so many patients, and some that want surgery, some that don't. But can you share a story of a patient whose decision around surgery really changed their life in a way that is super memorable to you and you'll never forget?
Yes, several. And that's what I think one of the things I appreciate the most is helping guide them or counsel them on whether or not to make a decision and what our goals are. But the story comes to mind is there's a patient that only had the use of one arm. That patient had lost the use of the other arm due to a stroke. And so, really, I think Ben Franklin said this, but we realize the value of water only until the well is run dry. And that patient had a lot riding on, they had used that one arm to compensate for everything in their life. And that was, what they did for most of their activities of daily living. So the injury had come about because they were just using that one arm, and having a decision to pursue a surgery if something had not worked well or had gone wrong, that would drastically change their life. So I think that we talked about the element of not being in control. That was a huge factor for that person, and the stakes were relatively high. So it did go well, and the patient was very happy with their activity, and it allowed them to do so many more things, including drive a car, work at their job, take care of this, take care of others. But if it hadn't have worked, then it would have been a big change for their lives. We had a couple professional athletes who also had the same kind of stakes where if they hadn't got back to their certain level of performance, that they would have, lost the ability to provide for their families, or they would have lost a certain identity that they had and their abilities or their personality. So I think that getting those people back to their level, and I think we can put a link to one of my favorite just videos, and it's about this older gentleman he's working out, and everyone knows, doesn't understand why, but um, one of the surgeries was that so he could help take care of his grandkids because their kids needed help with childcare, so he wanted to be able to pick up his grandkid over his head, and he showed me pictures, and he was kind of crying about it. This video reminds me of that. So those are the kind of things that are really fun to see and really rewarding.
Absolutely. And that, yeah, I can imagine that being super rewarding and have clearly a lasting impression. I mean, that you're changing someone's life, you're helping them, you're helping their whole family by giving them that experience to have their full mobility and or the mobility to the maximum extent that they can have. So that's definitely super, super rewarding for sure. And, you being able to not only do the surgery, but then also again being that pillar for them and that knowledgeable person that's giving them advice and helping them make that decision or recommending what's best for them. And, even now you're looking back and remembering that client and that patient and that story that was impactful, as well as other ones and athletes. But when you look back years from now, what do you want your patients to remember the most about their experience? Either the surgery itself or the way that you guided them through the entire decision?
Mm. Yeah, I think that's a great question, and I still uh, ask myself or sometimes struggle with. And I want to be completely honest and transparent. It's great to see patients get better. It's great to specialize in a problem or help teach other people on how to hone their skills or their practice. But Layla, we've also had complications in our practice. If we've treated thousands of patients, we've had patients get infections before. We've had them, where the broken bone didn't heal the way we wanted it to. We had problems with scar tissue or whatever that may be. And so I think you're going to get my answer. It's the way we guide them through a decision, right? And it's not so, oh, that's great, we helped that person and the stakes were high, but it's I think, we're going to come back to agency and gratitude, right? And I think that that's the way I want to live my life. That's the way I want my friends and family to know that's what I believe in. And I think that even, those of us I'm a believer, but even those of us who are not religious or believe in God, I think they're familiar with the serenity prayer. And that is to say, God, grant me the serenity to accept the things I cannot change, the courage to change the things that I can, and the wisdom to know the difference, right? I mean, they even use that in AA, right? So, and most people are familiar with that, but it's changed a lot of people's lives. And essentially, the ability to make these decisions based on the information they have at hand and understand that they are not in control of everything, but they do have the knowledge that what they can control, they will process. And so if we can, as practitioners or friends or family members, help each other, guide them through the decision process, I think that's, all we can ask for.
Yeah, absolutely. Absolutely. And I'm sure that that even from the patient's side is what would be more memorable to them, especially the surgery, especially if you're nervous. You're probably not even fully thinking clearly. Your nerves are there. And then once it's done, it's over and it's essentially it's done. The scary part is over. And then, you look back on the process and remember the conversations with you and the lead up to the surgery and having that confidence. And of course, again, nothing's perfect. Like you said, there are things that come up and it's unfortunate, but it is, I'm sure everyone has done everything that they can to make sure that doesn't happen. But sometimes these things do happen. But still being able to give your patients the best experience possible and being there guide and guiding them through the decision and the process, I'm sure is something that they will remember years from now for sure. But definitely, I think we learned a lot about basically the whole process of surgery today, and really how you're able to help patients with guiding them through fear and guiding them through the best decision for them, whether it's surgery or not, and really taking the time to learn their life and learn their lifestyle and their habits and their goals to really be able to decide the best decision for them, especially like you said, not being a scalpel first surgeon. So helping them go through that process, and even going back to your example of how some people like yourself at one point just wanted surgery, whether it's the best decision for them or not. So taking that time to really learn them and guide them through is super important. So I know if I ever needed a surgery, I would want you to be my provider for sure, and help me go through that decision process.
I appreciate that. I think it's also a responsibility, right? And
Mhm.
if we're advising a friend or or colleague or something in our line of work, and I think most people do, um, I think that that's going to make us better. It's also going to be harder if there is a problem or mistake. We have to hold ourselves accountable and responsible. So I think that too. I'm obsessed with a couple authors to help guide me make decisions in my life, and then to help others make those decisions for their lives too. Is a parent, right? That's one of our mission statements. But um, uh, they kind of said, Arthur Brooks kind of said that there's three elements of making a decision that each person can kind of dig into, and it doesn't take a degree, it doesn't take rocket science, but it's what's your level of excitement, what's your level of fear, and what's your level of emptiness, right? And so whether you're deciding about picking a job, um, picking a significant other or a spouse, or pursuing a surgery, right? It's the level of excitement would kind of be around like, hey, do I really think that this is the right decision for me? Will it improve my quality of life? Will it be the best on the things that I want to do? Will it make me be fulfilling or have a purpose or be meaningful? And that like that's kind of an initial gut reaction. The level of fear, I think it's okay to have some fear, expectations of the unknown, right? Fear of the unknown, or trying to achieve something that possibly has a failure. I think that we will all experience that, but some of the biggest forms of meaning and purpose have that. There's no guarantees in your job or the spouse that you date or the house that you buy or whatever that may be, or the surgery that you pursue. There's probably no guarantees. And then the level of emptiness is saying that's another gut feeling of saying, hey, something is not right for me. I don't understand this, or it just does not make sense to me on a fundamental level. And I think that those three levels I want to help me choose whether, you know, again, a job, I think that's great advice for those looking for dating, or, or many things you could apply when we all have to make these important decisions.
Absolutely. No, that's a really good comparison, something I wouldn't have even thought about, but it's true. And there is a little bit of unknown in everything too, right? Like you said. So definitely, I think a good point and a new perspective on how how much really goes into that thought process, right? So yeah, well, thank you so much for sharing all of that. And that's it for today's episode of ShoulderWise, the end of episode 3. So thank you again, Dr. Zerlip. I think we tackled a lot today. We tackled one of the most important questions in orthopedics. Do I really need shoulder surgery? And you showed us that the answer isn't always yes. It's about clarity, honesty, and the right timing. So make sure everyone listening subscribe so you don't miss the rest of these episodes, because better movement starts with better understanding.